Constance Beutel, 1501 Shannon Court for the last 29 years. Good evening, Mayor, council members, city staff, and fellow Benicians. This is my third in my march to the sea of 5 presentations on air quality and monitoring. And tonight I want to talk about air quality and health. How do pollutants affect our health?
Be sure to lean into the microphone.
I'm leaning in. Let me lean in here. Okay. It's tricky. You know, I've got to come over here. Okay, the levels of pollution that affect our health are set by the National Ambient Air Quality Standards, NAAQS, of the Environmental Protection Agency. They have a review process that includes scientific studies, risk exposure assessment, public comment, interagency review, etc. What are the health effects for criteria and toxic pollutants? They are particulate matter, ground level ozone, carbon monoxide, sulfur oxide, nitrogen oxides, lead, benzene, black carbon, ethylbenzene, hydrogen sulfide, toluene, and xylene. Ozone irritates airways. The symptoms are cough, sore, scratchy throat, etc., and asthma symptoms. This slide provides more detail on short-term ozone exposure and the respiratory effects. These studies found that an increase in ozone resulted in an 83% increase in school absences. Particulate deposition from particulate matter shows that PM10 deposits in upper respiratory tract and particulate matter of PM2.5, as Dr. Council Member Tom Campbell pointed out several weeks ago, are inhalable and penetrate the lungs. Particulate matter smaller than 0.1 micron may enter the bloodstream directly. Sensitive groups for particulate matter are people with cardiovascular disease, lung disease, older adults, children, and those in a lower socioeconomic group. The Veterans Affairs study published this year has found that the global toll of diabetes attributed to PM2.5 air pollution is significant. Carbon monoxide exposure reduces the capacity of the blood to carry oxygen, thereby decreasing the supply of oxygen to the tissues and organs such as the heart. Sulfur dioxide affects people with asthma. Short-term exposure is linked to respiratory symptoms in children and are often related to ER visits and hospitalizations, particularly for children and older adults. Nitrogen dioxide exposure results in respiratory symptoms, especially among asthmatic children. The toxic pollutant benzene causes eye and skin irritation, headaches, dizziness, etc., and longer exposure can cause bone marrow damage and blood diseases like leukemia. Black carbon is related to asthma attacks and problems with heart and blood vessels. Ethylbenzene at short but high levels can lead to eye and throat irritation and dizziness. Long-term exposure can cause kidney and inner ear damage. Hydrogen sulfide produces a rotten egg smell, and short-term effects include nausea, watering eyes, headache, sleeplessness, breathing problems, digestive upset, and tiredness. Toluene exposure can result in irritation of the eyes and nose, confusion, headache, anxiety, dizziness, and insomnia. More serious effects can include kidney and liver damage and may be linked to infertility. Xylene exposure can cause headaches, lack of coordination, confusion, and dizziness. The Bay Area Air Quality District's May 2016 Planning Healthy Places Guidebook includes Benicia for implementing best practices to reduce exposure. Toxic emissions affect our health. And a cartoon from the Vallejo Times recently shows people near a fashion boutique waiting to cross the street. And the caption reads, "Sure, EPA deregulations hit the fashion industry hard, but they made up for it in hazmat suits. Boone." Thank you.